All right. Well, welcome everyone. This is the sadly final Convergence HQuick Patient Family Engagement for Equity think tank. Over the past 4 years, these have just been a really inspiring opportunity for me personally to learn so much from all of your hospitals and the work that you're doing around patient family engagement for equity. And hopefully you have all found space here in these think tanks to openly share and learn with one another over these past 4 years. And I just want to start by saying thank you to everyone who has been so engaged, attended a majority of these think tanks and participated in other patient family engagement for equity activities through Convergence HQuick. It's been an honor to work with you and support your hospital strategies to engage patients and family caregivers in your work. I guess I should start with an introduction. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners and have been leading these think tanks over the past 4 years and supporting all of your hospitals throughout this project. Joining me is Libby Hoy. Libby, did you want to say hello? Maybe not.
If my
Oh, there
computer
you
will
go.
allow me, I think my computer is also maybe done. But yes, hi everybody. I'm Libby Hoy. I'm the founder and CEO of PFCC Partners and Lindsay's partner in crime in these tanks. And we have people come in and out of these as they need. And I think it's just been such a great opportunity for us to learn from all of you about the challenges so that we can provide more support and more technical assistance. But the best part of the think tanks is just learning from each other, having a space for that peer learning opportunity. So it's been a delight over the last 4 years, and I hope that you'll all stay connected with us.
Yes. Yes, please do stay connected with us. This isn't goodbye, it's see you later. See you another time. Thank you, Libby. So for our final session, we wanted to do something a little bit different. So I've extended this session. Typically, these are 30 minutes, but we're going to meet for 45 minutes so we can do a stop, continue, start activity. So we will jump right into that. But first, just wanted to recognize everyone who's on and who has introduced themselves in the chat. So thank you, Tasha. Great to see you. Rachel, Helen. So if you haven't taken a moment to do so, please introduce yourself in the chat. Would just love to know who you are, what hospital you're from, and then anything you're looking forward to in this final quarter of 2024. Weird. Weird. All right, so to level set us and just to kind of kick off with a conversation. So over the past, I guess, month or so, a little over a month, Libby has been sharing small snippets, small segments of our Gateways to Patient Family Partnership program. We called it the Gateways Ultralight series. So walked through these 5 learning sessions and these 5 aims really that we know that set up for sustainable patient-family partnership programs. So I wanted to stop and see if anyone had viewed any of the segments or jumped into one or another and had questions or, if they sparked any additional ideas. So just wanted to stop and see general thoughts and if anyone had accessed the Gateways Ultralight videos.
Well, darn. We certainly would encourage you to do so. And I'll drop a link in the chat.
Thank you.
If that's helpful to you, it's okay.
No, it's okay, Rachel.
We know that you guys have so many other priorities. Absolutely. All
Yes.
good.
And Kate, I see your chat. that your advisory council is still in its infancy stage and can use the materials for future planning. Absolutely. That is what they are there for. You know, we just kind of chat through a really high level context of things that your hospitals should be thinking of when you're developing an advisory council or developing other strategies in how patients and families can be engaged. So, you know, we really focus on these lanes of engagement. So can you put together a survey that can help inform a project, or host a listening session or interview? So we talk through these 5 steps and using some of those examples. And hi, Annette. Excited to learn more how teams are weaving PFE as how we do business. Yes. And not because we have to or to check a box. That's awesome. We are here for that too. And what's so funny is I was on another think tank, earlier today with our partners in Los Angeles County, and heard from hospitals who have successfully sustained patient family advisory councils. And one of the facilitators shared that, you know, a year ago, the advisory council seemed to be this kind of checkbox effort, but she really feels that there has been a shift, and a shift towards this is how we do business. So they have patient family advisors joining their safety councils and their patient access committees. So it's really exciting to see when that shift happens and we start to see that weave of patient family engagement. Well, great. So we'll definitely continue to share the Gateways Ultralight. You can view the full series on our website. We'll make that available to you and your hospitals. And you know, we are here too. So again, if you have any questions or challenges that come up through viewing the Ultralight series, just ping us and let us know. I'll follow up with our contact information at the end of this session. Okie dokie. So I wanted to jump right into our activity. So this is stop, continue, start. So in just a moment, I am going to open a whiteboard that you will all have access to. And what we're going to do is take 2 minutes to respond to this first question, stop. So in order to move patient family engagement for equity forward, what will you or your hospital need to stop doing? So we'll focus on that for 2 minutes. Then we'll move to continue and think about what was your hospital or what is your hospital already doing that you will continue to do, and then move forward to start. And whenever we do this activity, this is where the fun is because people want to start something or brainstorm what to start. So we'll wrap up with what will you or your hospital start doing to move forward on your patient family engagement for equity journey. So knowing that we have, you know, some hospitals in their infancy, probably a lot to start, but definitely think through things that you may need to stop and things that, you know, you're already doing that are working and can support your patient family engagement for equity efforts. Okay, so let me stop sharing and share the whiteboard. So I believe when you registered, everybody got access to it. I thought that's how it would work out, but if it didn't, you should be getting access when I share it right now. Okay, see some folks in. And Tasha, this may seem familiar to you. All right, so what we're going to do is move all the way to stop. And so if you can see on the, the left hand of your screen, there's a toolbar. And what you're going to do is find the sticky note. It is the 1, 2, 3, 4, 5, 6 sticky note down, or 6 item down. So you can click that and then create a sticky note and put it under stop because that's what we're going to start doing. And so for the next 2 minutes, we're going to brainstorm everything that you or your hospital needs to stop doing that would contribute to moving patient-family engagement for equity forward. If you're having trouble with the board, we can also come off mute and brainstorm or put your items in the chat and Libby will help capture those too. So I am going to start our timer. So in 2 minutes, this is what we're going to focus on, just everything you want to stop doing. So who would like to start? So one of the things that I added an example here that we hear all the time is stop making assumptions, because we know a lot of the times we make assumptions about who will partner with us and who will want to participate on our listening session or advisory council. So I added that one to get us going. But what else? What are things you need to stop doing? Okay, I see folks making their sticky notes. And again, please feel free to come off mute and share or add to the chat. Oops. All right, we'll go for about 30 more seconds. Oh, I didn't know these comments were a thing too. Isn't that nifty? Okay, so what am I seeing? Being afraid of community negativity and perception. That's a really interesting one, but I definitely think a common one. We've heard that before. Making excuses why patients won't participate. Yes, that is something that I did. So I went through the Gateways to Patient Family Partnership program that I talked about earlier, and that was my fear, was who is going to want to talk to us? You know, where are these patients? And here are all the reasons why they wouldn't want to participate. But I think everyone that I've talked to who has been a part of engaging patients and families is always pleasantly surprised at the just incredible individuals who are out there who are excited to engage with your hospitals. Let's see, stop using the go for sticky notes. That's okay. I think that was a net. But I like those. Was that, huh?
No, that works. And
Yeah.
yes, stop overthinking selection criteria for PFAC membership. Yes.
Oh, I like that. I've heard that one.
And yeah, just really offering the opportunity for people to self-select in, so you know that they're, you know, engaged and prepared and have the time.
Mm-hmm.
Stop thinking it's too hard to hear the voices of others. It is hard, you know, and it's hard. You all go to work, everybody goes to work to do a good job and to, you know, really meet the needs of patients. And so it is hard to sometimes hear where you're falling short, not to take that personally, but to take it as an opportunity to improve. I mean, that's a realistic challenge for sure.
Mm-hmm. Yeah, it really is. All right. Any others, or are we ready to move to continue? Continue. Thank you. And it's funny because I can see who's typing. So if we scroll over just a little bit, we have another section for continue, and I'm realizing I didn't make these sections big enough. I thought I had, but it was so tiny at the time. So, what are things that your hospital is already doing that can contribute to the way in which you will be engaging patients and family caregivers in hospital improvement activities? So one of the examples that I've had here is listening and learning. Being here today is, something that you can continue to do is just continue to learn from others on how they're engaging patients and families. So what do you need to continue doing?
And maybe that's something that's going on at your hospital that's, a really good alignment. Maybe you have some patient experience work going on. So, how can you align with that? Maybe you have other reasons that are really motivating and supportive of the idea of patient-family engagement. So what are those things in your organization?
Continue to harvest the good, the bad, and the ugly. That's a lot of learning, it sounds like. Oh, and I like this one. So, yeah, so programs that are already going on at your hospital that, are right for patient family engagement. So, implementation of SBRT and community health worker engagement has helped. And Tasha, I don't know if you want to come off mute and describe SBRT. I always forget that one.
Can you hear me?
Oh,
Mhm.
yeah, I can.
Oh, it took a minute. ESPER is the screening, brief, intervention, and referral to treatment that we now implement. So it's an evidence-based approach to just identifying individuals who have, usually it's alcohol and other substance abuse treatments, but also other disparities or things within the community that they lack or needs necessary housing, just things that could help them in their care outside of their hospital visit.
Mm-hmm. Thank you, Tasha. Yeah, I
I think
think,
that's such a great point,
okay.
of, the opportunity to continue to connect with your community and community resources through that process. And that can be a source of recruitment for patient-family partnership. It can be a source of insights for you. Excellent.
Yeah, and I would say the same because I know a lot of hospitals are working on their social drivers of health or the screening and addressing for social drivers of health. So very similar. The more that we can tie that work to patient family engagement, the more accurate the resources that are being provided to patients will be. And they can be really a voice for the community as well. They're the ones out there accessing the community resources. So really tapping into your patient and family caregiver population to learn. um, I think one good example was uh, oh my gosh, I just lost it. And Libby, you talk about this one a lot. So, patients have a knowledge about when certain community resources
Yeah,
are available or open. I
exactly.
was trying to think of the one specific example and I couldn't remember.
Exactly. Yeah. Like, for instance, the food pantries and
Right,
what food pantry is available in the community. And if there are more than one, which one still has food at the end of the month. And,
right.
all of those kind of nuances of community, your patients and families can bring that information to you.
Mm-hmm. Exactly. So we also have continue to link facilities to share strategies regardless where they are in maturity. So continuing to, connect hospitals and learn from one another, connect to community programs, and then sharing the opportunity to engage patient family partners in quality work. I really like that because a big part of, you know, that switch from moving to checkbox to this is the way that we do the work. It's a lot about communication and communicating with teams and your staff about the opportunities that are available to engage patient family partners in work. That and leadership is what I heard from the hospital that I talked to this morning was leadership was key to move or make that shift from checkbox to the way that we do the work. Great. All right, so let's move then over to start. So let's see, we'll take 2 more minutes to go through everything that you personally or your hospital needs to start doing to move patient family engagement for equity forward at your hospital. Of course, my example is partner with patients. Start partnering. One of the most important parts. What else? Working toward us. Oh, it's still going. Oh, there we go. Start small. Talk to a patient or family caregiver. Yes. One small step can go a long way because that conversation can turn into something a lot bigger, like a formal advisory council or, you know, series of listening sessions, whatever that might be. Making connections within the community and engagement opportunities. I'm not sure who added that one, but would love to learn a little bit more. What kind of connections within the community?
That was me, Tasha.
Oh,
Just to kind of break the ice or kind of, so we have a small community and our perception in the community towards our hospital is 50-50. And so that's why stop like making assumptions. We could start by breaking down those, just having those conversations to break down the misconceptions so that we can have honest conversations. And then maybe it'll bring some positivity in beginning to take the small steps. That's kind of where I was going with that.
right. I appreciate that. Yeah, and I think it goes to the, you know, start small too. Just start to have those conversations and learn. And through that, you're also building trust too, which is essential to patient family engagement as well. So I really like that. And I wanted to let everyone know that Tasha has been through the entire Gateways to Patient Family Partnership Program boot camp that we did in New Mexico this summer. So has a little bit more context and a full plan to start moving forward with. So that's awesome. Well, great to hear. Thank you, Tasha. All right, that message is still coming. So with SDOH screening, ask hospitals to engage advisory councils or patient family partners to inform community messaging. Yeah, that's something that we've been talking a lot is messaging the social drivers of health to patients. You know, why are these questions being asked? What's being done with that information? And that is a fantastic way to engage the perspective of patients and family caregivers. And I see working toward a state PFAC. I may be assuming, but Annette, is that you?
Yes, ma'am.
Tell me more.
Well, we're waiting for the association's strategic planning, to come out, and we've been encouraging those, important partnerships. And I think if that comes out as a strategic priority, then that will give us the leverage to, bring folks from all over the state to say, okay, we've got some insight to share with you. So
Yeah. Oh my gosh, that's so exciting. That
It is.
would be amazing.
it would be amazing.
It would be, yes. It will be.
It will be amazing. And yes, Annette, please keep us posted on that, because that it would be something we would want to shout from the rooftops and have others follow.
Absolutely. Very exciting. Awesome. Thanks, Annette. Thanks for sharing. Yeah, we are definitely here to celebrate with you. I think, Libby's request goes for anyone. We want to, Tasha, when you start having those conversations and making community connections, let us know. We want to be the first ones to celebrate with you. And if you start to, have conversations with patient family partners about social drivers of health screenings and how to communicate that to patients, let us know. We want to keep learning with you and celebrate as well.
And to that end, I'm going to drop in the link to the Convergence listserv. It's such a fantastic place for everybody, and we
Yes.
can have these conversations ongoing. It's open to all, and it's something that they're going to be sustaining. So please have these conversations, share these wins, because we can keep this community going. I think that's a really essential piece.
Yeah, absolutely. Keep sharing and learning together. Awesome. All right. Well, thank you everyone for participating in this activity. We'll capture this and share it out with you. So if there's, new ideas to glean from this, you can do that. And then I believe I have this set up that it will stay open too. So if you want to, use it and keep adding to it, you could even use this as a template for meetings with your staff or new meetings with patient family partners. I just love this activity because there's a lot to learn from thinking through things that you need to stop, continue, and start, and then you can take this and turn it into an entire action plan too for your team. So appreciate everyone.
Yeah, and it's a great activity to take back to your team as well, to take back to the hospital, even if there's only a couple of you. Just to really think specifically to your hospital, kind of what are these factors that you need to take into consideration to create your action plan.
Yep, absolutely. All right, well, thank you everyone. So to wrap us up, instead of doing a check-in question, we wanted to do a check-out question. So as we exit our final think tank of the Convergence HQuick, which is just so bizarre today, there's so many final meetings happening, and it's sad. It's bittersweet, really, because there's been a lot of great work done throughout the last 4 years. But yeah, so I want to do a checkout question. So we have time to have everyone come off mute and share your introduction again, but would also love to know, what is one pearl of wisdom about patient family engagement for equity that you are leaving with, whether it's leaving with today or over the past 4 years, or whenever something has stuck with you. We want to know that pearl of wisdom. All right, so I'm just gonna go down our list here and start with Luke. Luke, are you there? I'm sorry to put you on the spot. I can come back to you. All right, I'm coming back to you, Luke. We'll go to Annette, and I see your Annette. I mean, your chat, Annette. So sweet.
Well, it's so true. It's so true. And I think, over the last 4 years of this particular project, one of the things that we've really stepped back and thought about is that this is not brain surgery. You know,
No.
I'm not quite sure when it became this really heavy, burdensome, when it's really just meeting people where they are. You don't have to agree with it, but just meeting them where they are and doing what you can.
Mhm.
And so I think that's what you all have been really masterful at helping us kind of break it down and make it bite-sized
Right.
learning so that it feels possible. So thank you.
Aw. We are so happy to have had the opportunity to work with you and your team, Annette, at the state. I mean, your hospitals are so fortunate to have such a
Mhm.
great resource. And, when we set out, we really wanted the Funfetti approach to engage patients and families across all layers of this project. And you and your team in particular really absorbed that. And so to now hear that you may have your own patient family partners in your layer of the work, I think that's just phenomenal.
Yeah. You're a layer of the cake. I appreciate that too, Annette. And I think that's something that we've really learned through the H-Quick and definitely through the pandemic is the need to break down patient family engagement to a bite-sized piece because we saw that with, all of the critical access hospitals we got to work with and just how under resourced all of the hospitals were through the pandemic with time and, resources and everything that, we had to think differently too about what patient family engagement can be. So I appreciate that stuck with you. All right. How about Helen?
I don't know. I just love listening to this. I'm just thank you everyone for sharing everything that you're sharing and all the work that you've done. I'm just in awe of this group. And I guess one pearl of wisdom that I've learned about PFEE that I'm leaving with is that you can look at what you're already doing and put a PFEE lens on your data, on your experiences. There's nothing really that I mean, there's a lot that you can change and do and look at, but you can also just put on a pair of PFEE glasses and look at your daily experience of what you're already doing and see a world of difference. So that's something that I learned in this whole program, and I'm just in awe of it. So thank you very much.
Thank you, Helen. I love that PFEE glasses. We should get glasses for everybody. So everybody can have their PFEE lenses on all the time. I love that. I love how you said that. Thank you, Helen. All right, Kate.
Oh, sorry.
Oh, that's okay.
I think it's been pretty good and I've been learning a lot. But like I said, we're still at our our PFAC has not met for like maybe 2 years, and we're just recently trying to revitalize them. So I'll be sharing the information with the director of patient experience so that she can, help. Use that information to help revive our PFAC.
Yeah, absolutely. Please do. Yeah, and maybe the pearl is, which I find a lot when there are hospitals out there who are trying to, put a patient family advisory council together and think that you're in this alone when, you're not. There are resources out there are people out there who are excited to help you, and there are other hospitals who have learned a lot through their own journey. So lots to learn, and we have plenty to share, so definitely share the resources here today and happy to follow up with you too, Kate.
Thank you.
Yeah. All right, last but not least, Tasha.
I'd have to say that coming into this in the beginning was, I remember expressing great angst and being overwhelmed. Like, how are you going to implement a PFEC when we have to do SDOH and we have to do SBIRT and we have VBP and we have all these other things we're implementing? How do I get people on board? And one thing that stuck with me as a pearl of wisdom is the phrase, this is not new work, it's a new way to do the same work, which kind of ties into Helen's version of the PFEE glasses. It's the same work. If you just put on those glasses and reframe it, you can see that you can apply the data. You can, I mean, the goal is still the same, to help the patient.
Mhm.
So it's not new work. It's a new way to do the same work. And I think that's helped it become more bite-sized and feels a little more manageable. But that's the pearl of wisdom that I have from this
Awesome.
program.
Thank you for sharing that, Tasha. And it's great to hear. I mean, I took that quote from Libby, so it's spreading. But
It's great.
glad it's resonating too. Yeah. Awesome. All right, Libby.
Oh, my pearl of wisdom.
Yeah.
Ooh. For this group in particular, I think what I've learned from all of the hospitals in the Convergence H-Quick specifically is resiliency. I mean, I know that word was tossed around a ton during the pandemic, and maybe it wasn't as meaningful, but what all of you are doing and working on a PFAC that's been dormant for 2 years and starting a new one, all of those things, that's resiliency in action. So my pearl of wisdom is, when you think you're done and you think you're out, just keep going, because your patients and your family caregivers are always there, and they're always there to be a resource to you. And so when all of those factors that we looked at and what you can start, stop, and continue are in play in your organization, just kind of grounding back to your patients and your families are there to be partners with you. And just, what I've learned from all of you, though, is just a dogged resilience. Yeah. And I'm sorry that it's been so hard, but I'm so grateful for you to show us that way.
Yeah. Thank you, Libby. Yeah. Super grateful to all of you, one, for being here, but to all of the hospitals. What I've learned is, commitment and consistency from all of the hospitals, because, no matter how many hats somebody wore at their small critical access hospital, or how many projects that they had going on all at one time, they would still be here at our, 30-minute monthly meeting, for whatever reason. If it was, maybe it was a brain break from everything else that they had going on, or, maybe they wanted to really keep patient family engagement for equity top of mind for their hospital. But I just always appreciated seeing some of the same people over and over every month, with that consistency and commitment to patient family engagement. So thank you. And thank you, everyone. That kind of brings us to the end of our session today, and just full of gratitude to all of the hospitals, all of the state hospital associations, and our partners at Convergence for just an incredible 4 years of learning and growing together. Like I said in the beginning, it's not goodbye, it's see you later. So please keep in touch. I put my email in there, but I know Libby also shared the listserv information in the chat, and we will definitely follow up with everyone who registered with more ways that we can stay connected. So thank you all so much. And I don't know, I feel like I should say Happy Thanksgiving, Merry Christmas, Happy New Year. No, we will talk to you soon. Keep in touch, everybody.
Bye.
Thank you.
Bye.
Bye.
Bye. Thanks so much.
Thanks, everybody.